things that I decided to do is do my end at the beginning. Therefore, if I'm not rushed, we don't have to worry about it. We'll just cut it off. I was taking some notes, and one of the things that I'm going to sort of play upon is 3 or 4 of the other speakers. I, first of all, would like everyone in this room to rethink the word facilities. I really think what you are engaged in is the built environment, whether that's to supply, to maintain, to engage, or to activate. So facilities kind of sounds like a machine room. It kind of sounds like 4 walls and a roof, when in reality, you're creating an environment for patients, for doctors, for all of your staff. And that's one of these mental shifts that I also heard in the last presentation. The term that I use, we've heard all kinds of things between innovation and really innovation and sort of innovation. And one of the terms that I like to be able to use is to understand words that are simple to me. Evolution, revolution, and migration. I like to be able to think of evolution are those small little changes that in the long run add up to good things. May not be instrumental, may not blow a rocket launch, may not be a moon launch, but it is those things that every day make a difference. The other one is migration, which means there's a good idea over there. How about I bring it over to me? And I think that speaks a little bit of the same thing what we saw here in some of Hope and those other ones. And then there is that big bang revolution that every now and then is this disruptive technology that made all of those good to great companies maybe not even on the map anymore. So for me, that's kind of how I judge it. And I think today when we talk about the well building standard, think about it as migration. Think of it as something that's actually been in another part of the built environment that we're giving you a glimpse of. We're standing on the rooftop 3 years ago and we're yelling to the building world, the corporate world, the development world, the K through 12 education world, hey, your buildings can positively affect the health and well-being of the people in them. I think that same opportunity is going to be here in the healthcare world, and we're here as a sponge because our goal is to understand how a standard like a well building standard could apply in some of the medical world. So with that, and by the way, this just isn't for somebody else. There's probably 10 different individuals or companies or firms or organizations who are already engaged in the well building standard. Even though you may not recognize it, I know you recognize that you're part of big organizations. So with that, the well building standard is solely about people. Energy, water, waste, recycled content is extremely important, but it's not part of this standard because it already exists someplace else. So why do we want to create any confusion? The ability to say that it's not in conflict with sustainability is number 1 on the list. Nothing says that a healthy building has to consume more energy. And what I want to say is most of us never intentionally built a bad building. I'm a mechanical engineer by background, worked for UTC Carrier, a great design build mechanical contractor. I've got my PE stamp. I worked for a general contractor. I built every virtual type of building that there is, and I know I never tried to build a bad one. But I also know that I tried to do no harm. I don't know if I really recognized that a building could be augmenting, not just being neutral, not just being benign, because I never knew that what the doctors knew. And that's what we're going to talk about as well. This is also a key numeric. Why is it important? If we spend 90% of our time in a building, that building better do great things for us. If as a commercial real estate company, if as a corporate employer, if as a major consultant, if we spend 90% of our money on our people, and those people spend 90% of their time in a building, I can't ignore that fact. And to also recognize that these 3 wonderful silos that very rarely were ever in the same room, but generally never had the same information, were health science, building science, and business and economics. You might got 2 out of the 3. But I will let you know that I was never engaged, even in building a hospital, with understanding what the overall science was in terms of what we needed to do, in terms of, other than infection control. So we're in buildings a lot, we spend a lot of money, and it's underutilized. So for that reason, whether this graph applies to you or applies to anyone else, or you don't think it applies to you, the ability to attract and retain great talent, and at the same time reduce the negatives and increase the positives. Whether the negative is a sick day and the positive is a great idea or keeping a client, I like to concentrate on retaining the talent that we've got. It creates stress when they leave. Your customers certainly know it. Your organization knows it. You and I have to hire 4 or 5 people to hope to get 2 or 3. and maybe a client or a great idea leaves with them. Every time you hand off a baton, I see it as a weak link in the system to be able to understand how we're going to improve our business. So the goal of the well building standard was to bring these three silos together. So everything that you are going to see in the standard is not new. It's peer-reviewed, evidence-based science. It was a matter of mining and gleaning the best available research that already existed and simply bringing it together for us as non-doctors to potentially create superior environments. I would like to be able to say that we didn't do it alone. And in fact, I was a peer reviewer. Individuals from these organizations were engaged in the peer review process. And when you get a free download of the standard, you will recognize those individuals. So you may recognize an organization that's you. You may recognize one of your partners. The fact is, it's not an organizational review, it's an individual review. But it wasn't done by you and I. It was done by those doctors. But what you and I did do is you were engaged in the process of facilities, operation, design, maintenance, controls. The ability to understand that we may not be doctors, but we as an organization need to organize this so that it can be implemented. We wanted to create the biggest easy button you could possibly get. Life is tough enough. Construction's tough enough. Design's tough enough. The fatigue of another something is tough enough. Why don't we have an opportunity to at least make it as good as we possibly can? And for you, again, shouting from the rooftop started about 7 years ago. It's been out there in the marketplace. It's in 26 different countries around the world, hundreds of millions of square feet, hundreds of projects. So the fact is, it's got us more than training wheels. And we stayed away from the healthcare market because we recognized it had its own challenges. So again, free download under wellcertified.com. It's a public document, okay? You will also have these slides available for your own use. It's designed for you and I. It's designed for execution from subcontractors through suppliers. The last line is probably one of the most important ones. We said, our peer review group, those people that were representing you said, if it doesn't apply to existing buildings, then frankly, it only addresses 1% to 2% of everything that's new and only addresses 1% to 2% of the people. So existing buildings are really 98% of the opportunity if this is always about people. And that's the key component. There's no guarantee that a new building is going to be a great building. Therefore, there's no guarantee an existing building can't pass. I'm going to go over this quickly. You can read faster than I can, but it was also about what processes have we done with past certifications. What did we learn as an industry over the last 15 to 20 years of LEED or BREEAM or Living Building Challenge or any kind of a certification program? The key is make it about testing the results. Make it about performance rather than prescriptive. Make sure it's not a one and done. And make sure you're not asking the client to buy and do things that they don't know how to do. In other words, include the testing in the space. Make sure it's physical testing, not just paperwork, because the results are what count, not promises. It is designed in the commercial world for both that core and shell developer. In other words, I'm going to do something for my tenant. It's also designed for that tenant who exists and doesn't necessarily have control over the building. And it certainly exists as a whole building where you control not just the construction, but the operation. That's probably most of you, but at the same time, you don't always own your own buildings. I've heard that before. You occupy other spaces. We've talked about it for office building world. It's also in multifamily, education, it's in retail. There's a developing standard for communities and cities. Moving it into sports, fitness, and recreation, large public spaces like airports and shopping centers, and yes, the medical world. But the medical world will primarily not be about a direct intervention between the doctor and the patient. They're there for a very short duration of time with a very intense scope. This is about the people in the space. This is about the 10 people that service every patient. This is about the 20 people that service every patient. What can we do to improve not only their personal health, and we know that medical workers have some of the worst health performing criteria, high stress, shift work, poor diets, poor education, high stress, difficult family lives. So what can we do to make an environment better for them that's physically better? And I think that'll drop right to the bottom line, whether that's in terms of less errors at 2 a.m. versus 2 p.m., and the ability to understand how we can maybe make a smile recognize an issue, recognize a symptom, because our cognitive skills are better. Every page of the standard, and by the way, there's about 100 different things you can do. Half of them are required. Half of them are non-negotiable. Those are the biologics the doctor said, sorry folks, this is the minimum on maximum on 2.5 in terms of fine particulate matter. This is the water quality. Every page is here to remind us as facilities managers, architects, and owners, it's about the people. It's not concrete, steel, ductwork, or power. It's the respiratory system, the skeletal system, the skin system, the auditory system. It's designed not just to be about stuff. It includes food, it includes nutrition, it includes operation. It's evenly divided amongst all those things that the doctors say. It just wasn't scientific health. It was mental health, social health, cultural health, and physical. It's about behavior and it's about policy as much as it is the things in the building. Because frankly, you can't have a platinum building if you don't have platinum behavior. And if we recognize it's just about things, it's different, which means human resource is going to have to be in the room. Facilities or built environment is in the room. The designers, your supply chain is in the room. One of the things that I always see it's extremely difficult is that we're bombarded by information, and facts like this mean I don't have to do anything. Too hot, too cold, too wet, too dry, too green, too blue. We're inundated by facts, but don't give us information. And what we've tried to do is to understand we have to do better than just supply facts. The other thing is we have to recognize is that we have to create this overall business case. And the business case has to be grounded upon what's the value of my properties, what's the value of either to be, you can call it the war for talent, you can call it an employer of choice, I don't care what your vocabulary is. It's not just Google, it's not just Facebook, it's not just Deloitte and Ernst & Young, it's you, it's me. The quality of our organization can only be extended to our true business by the quality of our people. And ultimately, if we do these wonderful things, we're going to have healthier people. Because frankly, right now we're getting sicker sooner. We all know that. And that's not a sustainable economic engine for any of us. So what we did, we were invited 2 years ago by the Mayo Clinic, who were one of the peer reviewers, as some of you were. They said, folks, the problem is we've got clinical laboratories, and we've got environmental laboratories, and we've never put them together. So what we did is we built a living laboratory that took those, not those 3 silos that moved them into a standard. We're now starting to understand the relative impacts of air, water, and light, and food and nutrition in a real life working space. Because most research is 1 inch wide and 1 mile deep. Not that the doctor doesn't talk to one another, but frankly, we've developed such key areas of expertise that most of the studies that were in the standard are isolated standards. So we physically build a modest 7,000 square foot laboratory that's disguised as an office. I can make it look like this conference room. We can make it look like an open area. We can put mahogany walls and make it look like your lawyer's office. We can have what would be tunable circadian light, from the best light that the doctors would say today to the worst incandescent or fluorescent light you can imagine, and you've probably got in your building. The ability to understand how we change temperature, humidity, filtration, how we look at air, how we look at shades, how we look at light, how we look at electrochromic glass, whether it's shades or whether it's view. Is it energy? Is it light? Is it views? And this is a HIPAA compliant. This is run by an IRB. So the ability to understand this isn't casual data. This isn't weak data. This is going to be publishable data that we're all going to be able to have access to understand how to make it work. What are these variables and how do they work together? We think it's a key component to what happens. Now, from our perspective, there's a lot of information going on. And this is not meant to, by any means, provide you with a comprehensive understanding of the standard, but it is here to cause you to think a little bit and to potentially understand, as we go forward, who in this room would like to be part of the sweat equity that helps us put a standard together. That's primarily why I'm here. You're experts at what you do. You know who the other experts are that aren't here that ought to be working with us, because just like we did before with that peer-reviewed group, just like we did before with the industry group, that's how the process works to get a standard that is piloted and then rolled out. It's designed to be multidimensional, from South Carolina to Alaska, from Seoul to Shanghai. One of the most important elements is we looked at it. I'm an engineer, so I had a chance to write the owner's project requirements for that lab. Pretty exciting for me. But the other requirements were the biologics. So you talk about the Internet of Things or the Internet of Everything. I think it's the Internet of Me. Pretty soon it's going to be about those personal wireless wearable devices. So in addition to looking all about those physical things in the space that you and I know, temperature, humidity, filtration, and light, the doctors are looking at blood pressure, galvanic skin response. They're looking at stool samples. They're looking at all those different elements that go into what it takes for a human being. Because it's not just about optimizing it at a car running at 10,000 RPM with no oil. That's not a sustainable engine. So if you can understand, we're looking at external biologics, or external environment, internal biologics, and we're also looking at work productivity. These are people from the medical digital records group doing their work. The first 16-week research is 4 weeks in the environment as much as we could duplicate where they were at. The next 4 weeks is to the highest level interior environment that the doctors would tell us. The next one is code. The next one is where the people tell us they're most comfortable. That's the kind of data that we're going to be able to provide. That yes, it's currently in the office building world, but how many of your functions are truly office building world? You might call it medical, but it's not that much different in terms of knowledge-based workers delivering on time for the right kind of products. We're also working with other institutions. Some of you may have heard about a research study that was just put out by Harvard in conjunction with Center for Excellence in Syracuse and United Technology, where they physically did some of this space. It was limited to CO2 and VOCs. So the fact is there's a lot of research studies going on, and this one was a real-life space, and they're starting to measure the cognitive relevance of us and how we're able to process data and act upon data based upon air in our space. Now, it's one thing to say we're going to do it in an isolated lab, but you recognize they're now doing it across the United States. This was published and presented at Greenville in collaboration with the CBRE, where they're physically doing it in multiple offices to do that very same work to see how they can potentially draw relevance in publishable data, not just in a lab environment, but a real-world environment. The lab in Rochester is designed to capture data from everywhere, not internally looking, but it's designed to be able to work and make it work and draw it and make sure that it's also applicable in other areas. There's labs under consideration in the UK and China, as you can imagine. So I'd like to be able to show this because in reality I'm a little bit over, but to understand not just the well building standard, but how we all work and live in this whole healthcare continuum. Whether you're at school, whether you're retired, your work life, your live life, the ability to understand that we know that negative things can move from work to home. We also know that positive things can move from work to home. It's not a one-way filter. It all works together. So with that, I did a little bit of research. This is what's reported. I'm going to call this generally correct. If the office building world, if commercial world, if banks and Google spend 90% of their money on their people, you guys spend about 60% of your money on your people because you've got some other external expenses to worry about. Still a big number. And I hate to tell you that energy isn't important, because it is, but it's the empty side of the fuel gauge. So the ability for us to link our resource consumption with high productivity environments for our people that are healthy for them at the same time, I think puts you right at the opportunity, the nexus in terms of what success could mean for your businesses. If we went over a lot today, break it down into 3 easy pieces. If I take evidence-based, peer-reviewed science and potentially put it in a better building, I think we're going to get a better environment. And if we put people in a better environment, science tells us we'll have healthier, more productive people. And we think in the near future we'll be able to make that same kind of transition, that same kind of migration work from the commercial world to you in healthcare. Thank you.